Miss Morrissey. Yeah, yeah, I'm well aware. Well, I'm gonna make that decision when it's time, not before. Okay. All right. I appreciate it. Oh, hey. Sorry if you were waiting a while. It's been a busy day. My name is Dr. Prince, and I'll be the lucky medical practitioner who's evaluating your problems today. You don't look like you're in particular distress. You look a lot better than I feel, that's for sure. I've been alternating clinic duty with shifts in the ER. I am beat. I'm just beat, but it's so hard sometimes to sleep when you're given these tiny windows and told this is when you sleep, go to sleep. I see from the write-up that Marcy gave me that sleeplessness is one of your issues, so I'm preaching to the choir. But yeah, I see here anxiety, non-specific depression, any suicidal ideation? No. That's important, obviously. There's sort of a checklist we go through to sort of assess a patient's risk for that sort of thing. And sleeplessness, not being able to sleep, is pretty high on the list. It's strange. Well, I guess it's not strange, but it's notable. It's remarkable that that a good night's sleep can actually do so much for your mood and do so much for your life, really, as a result. How long have you been anxious or depressed? Well, yeah, it's an unfortunate malady because it's one of those things that, all we can do is manage the symptoms. There's rarely a cure for depression, and often what happens is people who are depressed will spend a large portion of their lives sort of looking for the thing that is going to make them happy on a more than temporary basis. And it's very easy to find things that will make you happy on a temporary basis, but something that's going to keep you permanently happy. Things lose their luster after a little while. Life can lose its luster after a little while. That sounded defeatist. I don't really mean it that way. I'm just saying that there are coping mechanisms, cognitive behavioral therapy. There are, and these are just ways you sort of approach. It's really sort of self-actualized treatment. It's sort of giving you the keys to the car that will drive you to a happier life. And that sounds very, very Tony Robbins, but it can be very effective for some people. Of course, there are other things that can be effective as well. Some of them are, fairly pedestrian medications, and some of them are more extreme. And in the past, those things like that could include surgery, and actually physiologically attempting to almost ablate the circuit in your brain that causes the depression, or allows the depression to linger longer than it should, because nobody is happy all the time. And if you think people are happy, then that's another, I'm a firm believer, and this is certainly not news, but social media has sort of really done a number on a lot of people, because all you see are happy moments, and it's very easy to start to believe that you're the only one that isn't happy. But of course, this isn't true. You're just seeing the happy moments. You're not seeing the nobody posts. Well, some people do, but by and large, people don't post videos of their intermarital spats, or problems with coping with their job, or losing their job, or talk a lot about money troubles, or their unhappiness with the state of affairs, just sort of generally. And there are a lot of reasons for that. One of those reasons is that people tend to be on social media because they want to be validated, they want to be liked, and it's difficult, or I should say it's easier to be liked when you don't have anything that controversial or polarizing to say, and you can just post pictures of a cute dog who is seeing its owner for the first time in years, and is very happy, jumping around, and make everybody's day a little bit brighter, and get a lot of likes. And that can be a way where you can actually, I'm positing it as a negative, but it can also be a positive in that that is one way. Those feelings of validation, if those do something for you, there's no reason to scoff at them. Really, if you're not hurting anybody, as long as you're not hurting anybody, you should take solace where you can. Of course, one could argue that in a rather sort of insidious way, you are hurting other people by pretending to be happy all the time, because you are throwing their lives into stark relief. But this is a rabbit hole that, and there's no end to it. And you could keep sort of turning it around on its head and back again, and just keep going ad infinitum, most likely. I don't know how productive that is. It's certainly not productive here in this clinical context, where we just want to make you feel better today. Today, if possible. A lot of these treatments take time, but at least get you on the road to feeling better today. So I should say that how traditional are we? We're a fairly traditional practice. However, one of the great frustrations among most doctors, in fact, is the sort of molasses, the treacle that one must wade through, or that new therapies must go through before they are not only approved by the FDA, but then covered by insurance, because lots of treatments get approved by the FDA, but insurance won't touch them, and they may as well not be approved at that point, because especially in the early years when the patent is held, if it's a pharmaceutical remedy, it's going to be very expensive, and if you don't have insurance, for most people, it's going to be out of reach. But the frustration comes from partially from that, and mostly from the just the sluggishness of the FDA to approve new treatments. So we're a mostly traditional practice, and we triage as needs must, right? So if we can traditionally treat you and get a good response or an acceptable response, there's no reason to go outside the bounds of traditional treatment. However, if we get no response from traditional treatment, then that's when we start our practice. Will start to look at slightly more esoteric options. We like to think that we're open-minded about that stuff, and we also, take the Hippocratic Oath very seriously. I'm not working 60, 70-hour weeks for the past 20 years just to get rich or just for money. I'm comfortable. I don't need to be working that much. I and everybody, my partners as well, truly believe in this sort of approach to medicine that includes a more one sort of preventative approach, and two, just being a little more flexible, not necessarily just ticking all the boxes and saying, well, we've ticked the box, so now you go. And people think, first of all, we all die. Everybody's going to die. Going to the best doctor in the world is not going to stop you from eventually dying. Our role is obviously to grant you more time, and not just more time, but more quality time. It's really no good to get an extra 6 months if those 6 months need to be spent bedridden. And it's actually interesting, there's a study done recently, sort of what interval of time is significant enough, right? Because if I were to tell you right now that you're going to die tomorrow at 3:33, but I could give you a treatment, you could take these pills and you won't die until tomorrow at 3:34, it's unlikely you're going to take the pills, and that extra minute isn't really going to do anything for you. So, but if it were an extra hour, would that matter? If it were an extra day, or an extra week, or an extra month, at what point does the interval of time become significant enough? And of course, it's balanced against what the therapy is, that people will proactively, definitively want it, because there's actually, it's interesting, there's actually a tipping point for most people, and it's different for everybody, but they all reach that tipping point where it is, this amount of time is enough for me to basically try almost anything. And that amount of time tends to be 6 months. But for some people it's a month. For some people it's a week. There are people who would give anything for one extra week with their loved ones, one extra week to revel in the beauty around them. And that week, depending on your personality, might be the most fantastic week of your life. And in the end, all our lives are just a series of weeks, series of days, each individual day sort of judged by its own merits. And we just hope that on balance, there are more good days than bad days. And that's what our practice really kind of tries to do, is give you more good days than bad days, and more of the good days as well. So enough of our sort of credo. Let's get down to business here, shall we? We're still sort of like stuck halfway between analog and digital, but a fair amount of our work now is digital, and some of these therapies I was talking about are digital as well. Okay, so I have a lot of this information already, thanks to my PA. Height and your weight. I like to take vitals myself. I of course trust my PA implicitly, but I feel it's my due diligence to sort of do that stuff myself as well. Okay, so just a couple of questions. Let's see. So you're not currently taking any medications? Mm-hmm. And we already established you don't have suicidal ideations, although you are depressed and anxious. How does your anxiety manifest? Does it tend to be panic? Do you tend to withdraw, sort of not engage with the outside world, that sort of thing? Yeah, it's tough. Anxiety can often be, people will say depression and anxiety, but often anxiety is the cause of the depression, because it destroys quality of life. There's no question about it. Have you ever blacked out? Have you ever had a seizure that you know of? Lost time, sort of not remembered where you were for a prolonged period of time? And I'm not talking about like forgetting where you left your car keys, but I'm talking about losing an afternoon, that sort of thing. No? Do you drink at all? No? When I said medications, I meant both legal and illegal. Hey, look, I'm not going to judge any of that sort of thing. Cannabis will probably soon be legal in most of the 50 states, if not all. And we will look back on sort of how timid and scared we were to move forward with legalization. Of course, on the other side of the spectrum, there are medications that there's no reason for them to be legal. There's no reason for anybody to be taking these medications. So, swings and roundabouts. So as far as your allergies, you have no allergies to medications that you know of. Are you allergic to electricity? Like if you're near a transformer or high tension wires or your Wi-Fi router, any sort of, let's just say, undocumented but possible sources of an adverse reaction in the body, headaches, that sort of thing. None that you're aware of. Okay. All right. Contrails. You ever go out on a beautiful, clear, blue sky day and see planes in the air and see these extraordinarily long vapor trails, or vapor trails? I don't know what they are. But you've never noticed on those days that you feel better or worse or different in some way? No. That's good. I mean, it shows you're resistant to whatever it is that they're raining down on us. So, in your opinion, how many ants are crawling on my face right now? No? Okay. And in any way, do I appear to be a lizard to you? No. Nothing scaly green or forked tongue or anything like that. These are good signs. Some of these questions are like the wrong answer, and there's a rapid response. All right, so what I'm going to do is take your vitals, and like I said, I mean, we're a fairly traditional office, so we're going to try and treat you traditionally. And like I said, if that doesn't work, then we'll look into other things. Okay, so first, just fairly simple. I'm just gonna take your temperature. It's okay. Just open. .4. That's within the bounds of normal. Some people run a little low. So I'll take your blood pressure. I need your left arm. You don't need to pull up your sleeve or anything like that. Just relax. Your legs are uncrossed. It's fine. My apologies. Yeah, 120/68. It's not bad at all. And your pulse is quite normal. This is your pulse was 66, just about. I mean, minus the, although, depending on who you are, some people have sort of doctor's anxiety, and their pulse will be 5 to 10 beats higher per minute when it's measured by a physician, rather than when they're actually at their true resting heart rate. So either way, you're good. And I do just want to kind of listen to your heart a little bit. Just relax. You take a deep breath. Hold it. Let it out. Okay, another deep breath. Hold it. Let it out. Slowly. Okay, just breathe normally now. Okay, one more deep breath. Hold it. And exhale slowly. Your heart sounds great. Your lungs sound great. Very good. I'm pleased. And test your reflexes. So what some people don't know is that there are more reflex points that are worth checking than just the knee, the elbow. There's the chin. Let's try it. Ready? Very good. And then of course the knee. Let's get the knee. Good. Nothing's swollen down here. You haven't noticed any swelling in the ankles, anything like that? No. Okay, that's good. I gotta tell you, so far I'm quite pleased. Physically, I realize that psychologically, I don't mean that in a dismissive way. A psychological ailment is just as, and in fact sometimes worse than a physical ailment. So just do a couple more. So now I'm going to examine your eyes and your throat and your ears. Let's start with your nose, and this is just a light. Just a light turn on. But I just want to be able to kind of see up a little bit. It's okay. Okay. And could you just follow the light with your eyes? All right, I'm just gonna try not to blink. Just testing pupillary response. There's no ptosis, there's no, your pupils are contracting normally. That can be an early indicator of neurological dysfunction, but not the case with you. Okay. I'm just going to take a close look at your eyes. Try not to blink. Very good. And then finally, of course, the ears. I promise I'm not going to get too far in there, but I do need to take a look. Mm-hmm. This one. Okay. Looks pretty good. All right. Yeah, I'm happy with that. You have very clean ears. No wax buildup, nothing like that. Which is unusual and good. All right. So I'll tell you, so based on what I've seen, my sort of diagnosis would be that we probably want to start you on an SSRI. So this is Zoloft. I don't know if you've heard of it, taken it before. It is what they call serotonin uptake inhibitor, which just means that there'll be more serotonin swimming around in your brain than usual, which will tend to make you look at life in a more positive way and feel better about yourself. There's not a lot of side effects of this. There are sometimes side effects, and we can go over those. Almost any medication has the potential for side effects. I would say Zoloft is fairly low, and we start you at a low dose and then bring it up. Okay, well, yeah, I mean, I certainly don't want to, I don't even want to encourage you to do anything that you're uncomfortable with. If you're not comfortable with medications, then we don't have to go that route. That doesn't leave me a whole lot of options. However, it it does leave some of the more non-traditional options open that I was talking about to you before. And if you'll give me a moment, I can go back, retrieve some of the details that I need, and then I can go over this, the non-traditional approach with you, and you might like that better. What do you think? Yeah? Okay, great. So I'll be back in a moment. Just relax and look at the model of the ear. It's not very good, I know. But, there's no magazines in here, but look at the posters, and I won't be long. I'll just be a moment. Okay? All right. Sit tight. Marcy? Yes, I remember how to, of course, thank you, I appreciate it, but it's not necessary. Thanks. I'm back. I have with me a slightly less traditional looking doctor's bag, which contains slightly less traditional therapies. Now, we talked a little bit earlier about technology and social media and its role in our lives, both for good and ill. Now, I mean, in the medical profession, one of the sort of take the good with the bad things about the internet is what they call Googleitis, which is basically similar to intern's disease, which is when you're an intern, when you're a doctor, you tend to think that you have the ailment that you are studying. You start to manifest quite real symptoms sometimes. And it is that sort of thing that also happens, or can happen, if you Google almost any malady. You go through the list of symptoms, and you're bound to find one that you can say, oh, I think I have that, or I have that symptom. And, having one symptom is one thing, but once you start to have 2 or 3 of those symptoms, you can fairly quickly convince yourself that you are terminal from a very rare disease that you have no reason to believe that you have, apart from the fact that it causes headache and fatigue. So it's a double-edged sword, but the world is what it is. We have to roll with these punches. So one of the positives of it is, and this is one of the slightly more experimental ways, or one of the ways in which our practice is a little bit experimental, is there's a very traditional model for the doctor-patient relationship when it comes to specialties, right? So you have a general practitioner like me, a primary care provider, and the primary care provider acts as sort of a router, like a mail sorter for, takes care of the sort of textbook, nothing too unusual going on here sorts of issues. But if there's anything too specific or too odd, or that falls under one of the umbrellas of a specialty, then all we do is just send you to that specialist. This has its pros and it has its cons. One of the cons is, of course, it assumes that the general practitioner has diagnosed you correctly enough to send you to the correct specialist. And you know the saying, when you're holding a hammer, everything starts to look like a nail. Once you get to a specialist in a particular specialty, I'm not saying that they will find things that are not there, but they are looking for specific things. And seek and ye shall find. The rest is sort of fait accompli. And so there's a downside to that model, not to mention the sort of load it puts on the patient. I mean, you're taking time out of your day. You're probably missing work to come to a doctor's office. It takes way more time than it should for you to see a doctor in general. This is unavoidable to a large extent. The loads that we have are not, we probably shouldn't triple book, but it's not uncommon for me to see 50, 60 patients a day, an 8-hour day. You do the math, and that doesn't include the write-ups, afterwards, and the preliminary sort of scanning of files beforehand. So there's a lot going on in very little time, and if a doctor is rushed, that's not good for the for the accuracy of the diagnosis. So one of the things that has been being developed recently is sort of taking specialists out of the office and putting them in the cloud, and basically the general practitioner sort of curates the information that goes to these specialists, and oftentimes that is enough for these specialists to make a diagnosis. Sometimes it is not, and the patient still needs to go to the specialist. But this removes one level of inconvenience and cost, and it also means that specialists who partake in this sort of a program don't necessarily need to keep that regular office hours, because basically they get all the information beamed to them. So that's something I'd like to try with you. There are some psychiatric professionals, and like I said, it's every specialty. So there's the psychiatric specialty, but see, not only that, it also goes to, it's sort of like a fuzzy logic. So basically I would be typing in that I'm sending you to the psychiatrist's cloud, right? But it would touch everything that's sort of near there: neurology, psychology, specific types of psychoanalysts, like that sort of thing. It doesn't just go to the psychiatrist. It's a wider funnel, which can be very beneficial. So there's no additional cost to you. This is a cost that, for the time being, our practice is absorbing. So if you're interested, let's give it a shot. There's nothing gets attached to you. There are no needles involved. There are no electrodes involved. It is merely observation and beaming information via Wi-Fi to our routers to the medical cloud up there in the sky, with the contrails sort of crisscrossing, hopefully not interfering with any of the information that's up there. I, of course, realize the cloud is not a literal cloud. Okay, so to sort of help put our patients at ease, there's a couple things we do. Basically, the the scanning device that we use. We call him Dr. Omni, and it's basically just, it's just a camera, and it will be guided sort of by the sort of experts in the cloud to kind of know where to look on you and what to look for on you. So this is him. He's a nice little guy. He's got, those aren't his real eyes. That is just to sort of make you feel a little less threatened. But I can sort of hook up to him. Put this down over here for now. And communicate with him. And he can tell me sort of what he needs to look at, what he needs to see. Okay. What? That's what I'm doing right now. I'm doing it right now. Okay. There's no need. No need for that. Thank you. Okay, so I'm just going to have Dr. Omni sort of give you the once-over. I'm getting information already. Very interesting. Down. Up. Over. So really what this is what? Okay, sure. That's exactly what I'm doing. Thanks. Really what this is crowdsourcing medicine, in a sort of effective way. At least we hope it's effective. Mm-hmm. Yeah? You're done? Okay, that was it. That was easy. Okay, thank you. Put him down, and the results will come to me via a sort of secure, like I said, it's curated. It's curated by doctors. And based on the information collected, I also obviously sent him all the information that I had collected from you previously. We get the results. Okay. So, this is strange, but I'm going to go with it. So Dr. Bodie McBoatface suggests that I clean your ears to relieve some of your anxiety. Now, I looked at your ears, looked in your ears. There wasn't anything in there, but like I said, I try to be open-minded about this stuff, so I'm going to do what Dr. Bodie McBoatface suggests I do. Sort of a strange name for a doctor, but this is the system is global, so I don't want to be too judgmental about anything. Do what Dr. McBoatface requests. Now, to be honest with you, again, I'm not. There's no buildup in here. I'm not actually cleaning anything out. I think maybe the good doctor, McBoatface, thinks that the act is relaxing. This year, in particular, is especially clean. I don't want to irritate it, so I'm being as gentle as I can. This is why we have specialists, right? It'd be silly if I pretend like I know as much about anxiety and depression as Dr. McBoatface does. So that's what's more on both sides. You do seem to be a little calmer. Maybe there's something to this. President, judge. I'll tell you, your ears are going to be sparkling because they were already cleaned, so now they're going to be beaming examples of oral hygiene. That's oral, not oral. Obviously, oral hygiene is very important as well. Okay, how did that make you feel? Helped? Okay. You can't argue with results, right? I mean, unconventional method. I mean, people used to put leeches on people to try and suck the humors out of them. Nobody knows what they're doing. You know, we're based on the information that we have, we're trying to make the best guess we can. So I'm not, like I said, I'm not judging. All right, let's see what else we got here. All right, Dr. Fred Durst suggests that I squish bunchums together near your ears. Coincidentally, I have bunchums in this bag, so I'm gonna go ahead and do that. Durst, that sounds like a made-up name, doesn't it? My kids love to play with these things. noticing your eyes starting to droop a little bit. And for someone who's been having a problem with sleeping, it's a great sign. It just goes to show Fred Durst knows what he's talking about. Always listen to Fred Durst. So perhaps you can guess why, or perhaps maybe understand a little bit why insurance companies don't cover this sort of thing. I still think it's a bunch of bull, but I mean, they're bunchums. At the very least, I don't think there's any way that this could violate the Hippocratic Oath of you first do no harm. Which, interestingly enough, I mean, like, when X-rays were developed, people thought they were such a boon. They used them for everything. They used them all the time, and then they realized the radiation was causing cancer. And then they found new, less ionizing radiation ways of imaging, including MRIs, magnetic resonance imaging. But even MRIs now, they're saying there's some mutagenic, there are mutagenic consequences to having too many MRIs. It's not on the same level as an X-ray or a CT scan. But, when they were first being used, it was thought that they had absolutely no deleterious effect on the body at all. And of course, sometimes the contrast that is used in these machines, sometimes they are themselves harmful. In fact, I myself had what they call a nuclear stress test. And it was fascinating. I, of course, had done, when I did my rounds, did cardiology. So I'd seen them before, but actually experiencing one myself firsthand was it's just very interesting. You know, a stress test is they give you the Bruce protocol. They put you on a treadmill, and they gradually incline it and increase the speed until you reach your target heart rate, which is like 75%. I'm sorry, it's like 200 beats per minute minus your age. I forget exactly. Not a cardiologist. the smell of nitrile gloves to latex gloves. I also have a latex allergies. But they smell, I'm sure this is an artificial scent. They smell like fresh pine. Let's see how this works. It's weird me getting this close to you and scratching my beard. Seems to be working. I'm sorry, I said it seems to be working. In fact, you seem to be drifting off. But you keep your history.